Today, I'm very happy to introduce to our Russian audience the director and the guy who's leading EFT Tapping Training Institute. And he is making a lot of teaching courses, trainings for EFT practitioners. And he made a lot of studies about EFT, and he made a movie called Science Behind Tapping. Am I right, Craig?
I'll fine tune a little bit. So it's called The Science of Tapping. And the reason I say that is there's a wonderful new book out by Dr. Stapleton called The Science Behind Tapping. So
yeah.
It's a little bit different. And also I organize and I put together studies, but I haven't published or written studies myself. So I want to be clear about that. I help to share studies and educate people about the research, but I am not personally a researcher myself.
Okay. So, but first in the beginning, the question is, what is your personal story of your changes and results of EFT, with EFT, that so you decided to promote this technique and to teach this technique and study it?
So it's interesting. A little more than 10, 12 years ago, I'd say I was, so I'm a chiropractor by profession. Yeah, that's what I've been doing.
What kind of practor?
So I am a chiropractor, a hands-on, like an osteopath. In other words, I know in Russia that there's hands-on mobilization, like a spinal doctor that works with a hands-on approach to helping people. So I'm a doctor of chiropractic.
Okay, and what was your education, like university or?
Sure, yeah, you have to go through university and then through specialized chiropractic training, postgraduate, and so that I was a massage therapist for years before that. So I've been doing that for 20.
So you work a lot with human bodies. You know human bodies, how they work.
Yeah, I did. And so yes, that's what I've been doing my whole life. And so I had read about and heard about this EFT tapping thing, and I was really skeptical. I thought it was a bunch of hogwash, and you know, how could tapping on the face help your pain and help your health and help all these conditions and help you with relationships and emotions and help you, so I thought it was silly. And then I did some more research and I started to look into it more.
And
go ahead.
Did you meet Gary Craig or his students? How did you was acquainted with it? What results you have in your life, so you decided to study it?
Yeah. So what I did was I was hosting people to speak about different kinds of healing at my office, and presentations. And so I had started to become more curious about the EFT. And I looked to see if there was anybody in my area that did this. And there was only one person, because I live in a small rural community. And her name was Alina Frank. And she had studied with Gary Craig. And I invited her to my office to say, do you want to talk to my patients about this tapping? And she said, yes. And so it went very well. I was very intrigued and curious. And then I started to take a training with her. Now, of course, we're married and partners for almost 10 years. So it began that way for me. But at that point, it wasn't, I was working on some personal issues because I had gone through a bad relationship, and it was helping me with some of my emotions that way, and the guilt and the upset and divorce and all of those things. But I didn't really understand it until one day I had been working out in the yard and I hurt my back. I was bent over with my back, and I walked in the house and she asked me, are you okay? I said, well, I just hurt my back. And if anybody should know how to take care of their back and take care of it, would be a chiropractor, a back doctor, right? So I said, I'll take care of it. I'm good. I'll do my stretches and my ice. And she goes, well, let me tap with you. Okay, fine. You can tap with me. But you know what? It's not emotional. It's just physical. I strained my back. I've been working for 2 days out in the yard, digging and pounding. And so as we're tapping about my back hurting and my back's in pain, I started to realize that I was very angry about having to do all this work, and there was a lot of emotions about it.
Mm-hmm.
And as I started to tap on that, and as I started to release the emotion, my back got better and I stood straight up and the pain was gone.
Mm-hmm.
And then all of a sudden was this moment of, what was it? Was it my anger? Was it what I did in the yard? How am I going to take care of my patients now? I don't know whether they really hurt themselves or whether it's just their emotions that's keeping it in place. So that was that seminal moment of, uh-oh, right? What do we do now? So that's just a story of, for me, how it began until I started to then learn more and work with clients.
In what year it happened? This back thing.
This is, let's see, 2009 to 2009. So probably 2007, 2006.
Mm-hmm.
Yeah. Yeah.
And then you decided to make your institute, or you?
Well, that became
came to this institute.
Yeah, that became gradual because Alina had already been teaching,
mm-hmm.
and I was still being a chiropractor full time, but I would go with her to the trainings, and I would help in the back of the room. And because my background is in science, then I started coming to the front of the room and teaching more about the science part.
Mm-hmm.
And then she started teaching one day and I teach the other day. So pretty soon I was helping her in many different ways and loving it and learning more and becoming more and more involved. And then pretty soon we were traveling and teaching together.
Uh-huh.
And then my skills improved to where I'd be doing demonstrations as well. So out of that, the institute came and we were teaching at that point. So we've taught for most of the major organizations, not all of them, but EFT Universe, EFT International, AMET, and several others, the Matrix Reimprinting Academy. So now we've been teaching for years, and that also includes teaching workshops, mentoring students in how to become skillful practitioners in person, online. And so, yeah, it just keeps growing.
And how many people went through your institutes and your studies?
Oh, I have to imagine, I don't know, maybe I'm going to guess maybe 2,000, something like that. Something like, I don't count, but over the years, I mean, in September, I'll be teaching in Seattle and in Portland and in Montana, and then I'll be teaching in Atlanta and then right to Oklahoma City. So different places in the United States. And
you travel abroad?
Yeah, we've taught in Australia and in the UK so far.
And what areas businesses have? Like what your clients, what your students then do? In what areas, in what issues?
Yeah. Well, when we teach students, there's different levels. First, they come to a workshop or a training. If they then want to become certified or a skilled practitioner, then they go through 6, 9, 12 months or so of training and mentoring. And that makes them qualified to practice skillfully with other people. We also then have a program. So that program is just to help them become skillful in EFT.
Do they do it online? Do they need to go to some place to just online?
Sure. Well, those practitioners teach both in person and online. But then Alina and I also saw that many of the people that became good at EFT were not necessarily good business people. Right? So they weren't necessarily succeeding just because they were good at tapping, because they didn't know how to market themselves or do a business. So we started the Marketing and Business Academy, the EFT MBA, so that we could help people. And that exactly, and the reason I say that is because that's where we teach them and help them develop their niche and their specialty. So whether they're working with, people that are having insomnia, people that are having chronic pain issues, whether they're working with mothers that are trying to balance work and children, whether they're working, so all different kinds of areas of relationship, of business, of health, and trying to find their niche, because once they have a niche or a specialty, people perceive them as the authority, right? Or people that are highly sensitive, or working with, divorced mothers that are now trying to, start their lives again. So all kinds of different issues that they specialize in afterwards.
Do you have stories, amazing stories about these people about maybe their clients, like?
Well, I can't share stories about their clients, but we hear them all the time. I'm just thinking, so I'm just thinking of people because they work so well with all those. I think of people. I know one woman who specializes just in treating sexual injuries.
Uh-huh.
So in other words, a woman in Australia who's a counselor, and women that have gone through sexual violence, and then ones that move on with their life afterwards. And other ones that I'm thinking that can't sleep or that have skin conditions, and then those clear up. So I mean, I would say all of those people are working successfully with EFT, with Matrix Reimprinting, to help people to clear the pain of their past and then be able to move forward with their lives again, because that's so much of what we're doing with EFT, because we've all had various levels of trauma.
And
right?
yes. And what measures, what you talk about when you say about science in tapping, like what these things you're talking and what you made movie about?
Yeah, well, the reason that we decided to make the movie The Science of Tapping was because, at least here in US and Canada and other places, EFT, and I'm sure in Russia, EFT still only a small percentage of people know about, right? And just like I was skeptical at the beginning, if somebody finds out about EFT and they share it with their husband or their wife or their doctor or their whoever, and that person has never heard of it, this just sounds silly. So there was no good video out there at the time, this was 6 years ago now, that helped to speak about the science there is and the research that there is about it. And so we wanted to give somebody a DVD or film, something that they could give to their doctor, they could give to their partner and say, look, this isn't hooey, this isn't silly, there's real science behind this. So we included people like Dr. Peter Stapleton, who has done so much of the research in the functional MRIs, etc. We included David Feinstein, who's one of the main researchers that's published a lot about EFT. So we included guest experts in the film that helped to validate and talk about the effectiveness of the tapping research that's been published, so people could show this to their clients. They could show it up on a movie screen. And so that was our purpose, was to help people understand and to help to get it into clinics and universities and other places, so that there was something they could give them to help that happen. Yeah.
What Joseph Legomsky told us about 24% low in cortisol in the blood of 30 minutes of application. So what other measures, what other researches?
Yeah, actually, there's been a newer study that's even higher than that and closer to 40% after one session. So obviously, reductions in cortisol, which are the stress hormones, are important.
Yes.
We're starting to see brainwave research come out. We are seeing, for example, what are called epigenetic factors. So this is the tests that show whether certain genes are being expressed or not, and how EFT helps with what we call gene expression. So we're also having our first functional MRI tests, further follow up on the cortisol tests. Most of the research is what we call subjective. In other words, how somebody feels better afterwards, whether it's for anxiety, whether it's for depression, whether it's for post-traumatic stress disorder, whether it's for pain. So we see studies that show people's experiences improve significantly, but we're really only starting to get funding and money to be able to explore those harder measures, like things you can test in the lab. But it's happening, it's growing.
Yes, and also you're very keen in psychosomatic pain. What your client stories do you have? Like, have somebody who came with you with seems to be physical pain or physical issue, then you tapped with him, you discovered the issue, and then magic happened?
Yeah, so when you say psychosomatic pain, for me, what that means is that there's a connection between the mind and body. And 20, 30 years ago, or even more, maybe that was argued. But now it's not. We understand, and most people get that the connection between my stress levels and how I feel affects my body.
Mm-hmm.
How my body is feeling affects my thoughts and my feelings and my emotions, and they're totally connected, you know?
Uh-huh.
So number one, we have to understand that how I feel about something affects something. So if somebody
Mm-hmm.
comes into me and they say, for example, that that my shoulders are hurting, right? And that they hurt their shoulders, yes?
Mm-hmm.
And I say, well, let's talk about maybe some of the emotions involved. They say, no, it's just my shoulders. And I say, I understand that you feel it in your shoulders, but how you feel about having pain in your shoulders affects the pain in your shoulders,
Mm-hmm.
right? Sometimes people understand that their stress levels are affecting that, and sometimes they think that they're separate, right?
Mm-hmm.
So, you know, I'm also a practitioner of something called meta health, which I also helps me to understand how certain types of traumas and issues and triggers affect where and how people are experiencing that in their bodies. Yeah.
That is
So,
very interesting to see this table, like what part of the body, how it connected with emotions, and what
sure.
trauma means what.
And it's interesting. I don't speak Russian, but in English, many times the words we say about something help to give clues about the emotional factors involved,
Mm-hmm.
right? So, you know, in English, for example, somebody would say, it's like I feel the weight of the world on my shoulders.
The same in Russian.
Okay, good. So I
This
don't know. So
phrase
you'll translate, yes?
Yes,
And
yes.
so often if somebody's feeling a lot of pain in their shoulders, I will ask them, have you suddenly had some increase in pressure in your life or some sort of level of responsibility that has come on you? And they're like, yes, I was just promoted at work and now I have all this more pressure.
Mm-hmm.
And they start to make that connection.
Uh-huh.
Or if somebody is feeling vertigo and a loss of equilibrium and dizzy,
No,
right?
it's not so understandable. Okay.
Yeah, like spinning.
Uh-huh.
Yeah. So that often is, where in your life have you lost your balance?
Mm-hmm.
Yeah. Where are things topsy-turvy in your life? So the questions that we often ask about the symptoms in their body help us to point to the problems that are showing up in their body. So for example, if you work with people, and of course this is always specific per person. So I'm not going to give you a table that says somebody has this and it's that.
Here in
right?
interview, we're just asking you stories because
Sure, yeah.
teaching must be proper, must be very good, concrete.
Yeah.
No pieces. So
Yeah. So for example,
what are the stories? Yes.
yeah, so so I can think of somebody that came in and they had skin rash.
Yes.
Yeah. So, and
Irritation. I
yes.
heard that irritation, like anger or something like that.
Well, what I would say is, yeah, so if there's like a psoriasis or a rash on the skin often points to, the skin is like a boundary between me and other people. And if there's been some sort of conflict between me and another person that has perhaps involved being touched when I didn't want to be touched, or wanting touch and not getting touched, and recently something happened that brought that up, that can often, and I've seen that many times, flare up a person's condition. And what ends up happening is when they start to realize and they start to do the tapping on the thing that happened recently about that event, then the condition can start to calm and heal. Right? When we start to work with people, for example, you know, the musculoskeletal system, the muscles and joints and tendons of the body. And from a meta health perspective, depending on where that is in the body, it's often a problem where I'm judging myself for not being good enough at doing something. So for example, if in my, where I'm trying to, for example, in my hands, if my hands are really hurting, there's something that might be going on, and often is, where I don't feel like I have the ability to find things well. Somehow there's something in my life that I'm not able to grasp, right? If I'm having, and people that I've worked with many times that have digestive issues, right? Digestive issues tend to be around problems and conflicts in their life that they can't swallow, that they just can't digest, they can't accept. No, I can't accept that my son is going to move far away. And no, I can't accept the news that my daughter is not going to university. And no, I can't swallow the idea that I have to stay here in this situation for a long time. I thought I was going to be able to move on. So the digestive system often has to do about the inability to digest or process some piece of information.
Yes, and behind all that knowledge, you have stories, and again stories, like concrete stories.
Yeah. So I'm just trying to think of, for example, well, there was a woman who died. I'm sorry, whose son died, and was having tremendous digestive issues because a part of her just couldn't accept that he had died.
Yes.
Right. And so working with, and what had happened recently was, I think it was the anniversary of his death, right? And so that was coming up again. And so it was flaring up, lots of problems with her digestive system, and she wasn't able to process food. And so working on her being able to find peace with the death of the child was able to return her system back again, right? I'm thinking again about skin issues, another woman who had been raped early in her life. And that as she was starting to date recently, it was bringing up fear and emotions regarding that event that happened. And so her skin was getting all red and irritated and scratching. And so working on those events around that helped to clear up her skin again. So every single story about every client that shows up, without revealing too much personal information, is about them coming to terms with what happened, finding the understanding, finding peace with that, and then the body heals itself.
Do you use, do you use EFT or use EFT and Matrix Reimprinting in all this?
Yeah, I definitely use both. So for me, Matrix Reimprinting, I just did an interview. I'll share it with you. That's coming out. That where I interviewed Carl Dawson, who created Matrix Reimprinting. And Matrix Reimprinting, I don't want to say is an advanced form of EFT, but it's an evolution that came out of EFT. He was one of Gary Craig's founding EFT masters, and he went on to create this. And I use it a lot on early childhood trauma, because it's very gentle. So in other words, when I'm doing EFT and myself and I'm tapping on all the anger, so I'm thinking about maybe there was some physical abuse, and maybe when I was young, and I can be very angry about what happened. And I'm releasing the anger, even though I'm very angry that this happened to me and it should never have happened, right? And so I'm feeling everything that I'm thinking about with regard to that thing that happened. With Matrix Reimprinting, I'm closing my eyes, I'm using different points, and I'm imagining what happened. Okay, so I'm imagining, watching, and seeing what happened to me when I was 6 years old. And I'm imagining tapping on that little child. And I'm talking to that child to find out what decisions he made about the world, and whether he's not good enough, or whether the world hates him, or whatever it is. So it's a bit removed. And so it makes it a gentler process. Instead of me feeling all the rage, I'm imagining that little one and helping that younger me do that. So I use that technique a lot, especially when working with childhood trauma.
Does it mean that you can use it for yourself with no somebody being a practitioner, but you can use it to help?
It's harder.
It's harder.
So Matrix Reimprinting, I don't recommend most people do Matrix Reimprinting on themselves until they become a skillful EFT practitioner, because you have to separate yourself and keep yourself separate. Because if you start getting very upset, you don't have another person here to calm you down, right? So Matrix Reimprinting definitely works better with another person. But also EFT, as an EFT trainer, I say that there are certain things you know, in the United States, we have like stoplights, green, yellow, and red. You know, like a car, right? Whether you should go, slow down, or stop. So I like things that are mild things for me to tap on myself are green light. Sometimes things can be quite upsetting, and I call those yellow lights. You may want some help from somebody. And red light items are the time that I was beaten, the time that very bad traumatic things happen, and it's better to work with a separate practitioner than just do that on your own.
Okay. Do you have stories about money? I just usually ask people.
Stories about money.
Like how the money world changed after tapping.
Sure. Well, I can just speak. You know, the first thing that shows up is I can't show it here, but a lot of tapping that I had to do because I went through a stage where, as a chiropractor, I wasn't so happy in that profession anymore, and my money, you know, patients were going down, and it was getting slower, and I had to do a lot of tapping on that and that issue because, you know, what happens when money. Here's what I would say. Money is a reflection of how you're feeling inside. There's so much of how I'm feeling about feeling worthy about making money that shows up in my world of finance, right? But that's true about everything that we're working on. It's all an inside job. If I don't feel deserving of love, I don't have a partner that shows up as wonderful. If I'm not feeling worthy of abundance, then money starts to go down. So we were working on creating a new home because we were in a home that we weren't very happy with at one point. And so having to tap myself on all of the things that I felt that I deserved, that I didn't want to show off, that I didn't want to do it for other people. And now we live on a home overlooking the water. And we live in a beautiful home that, you know, makes me very happy. We had friends over for dinner last night and we're looking out at the eagles flying by. And I think about that because for me, having to tap on my concerns about what other people thought, having to tap on my concerns that, for example, that now I make more money from EFT than I do as a chiropractor. But I had in my head, but I went to school as a chiropractor. This should be how I'm making all of my money. So there's a lot of issues that come involved with why a person doesn't think they deserve good things. Because they did some bad things, because they're not smart enough. So for me, saying, look, I welcome, you know, however money shows up for me. Because it is only an indicator for me doing good work in the world and feeling that I deserve that. I'm not doing it for the money. But when I'm at peace with how deserving I am for those things, money flows more easily. And so when money all of a sudden starts, for whatever reason, doing this, it's very easy to think, oh, how do I do more marketing? And how do I do more busy work? And the first thing that Alina and I will say is, okay, we got to start tapping, right? What block is there that's all of a sudden making the money get smaller, right? So we start tapping on what are the emotional or energy blocks to why that's happening, start to tap on it, and then it starts to open up again. So it's all about on the inside. Yeah.
Yes. And now we're creating a Russian community, and you, as a creator, successful creator of community in USA, what would you wish to us, and what must be the points of successful community in Russia? So what should we pay attention on?
Okay, so a few things. I think number one, there are two different ways of creating community. Both are important. One of them, as we're doing now, is online. Because you can reach the farthest reaches in small towns and small places. And it's the way that many people find out about EFT and they can stay connected. So, and then there's also small groups in person. So for example, you create a community in Moscow, you create a community in, you know, other cities.
Maybe.
Yeah, St. Petersburg, for example. And then you get together. Right? And you do tapping together and you come together for 2 hours and you practice your tapping skills with each other and you work with each other. And then maybe you have the group online where you meet once a month and you can share stories and successes or challenges. So I would say, especially as EFT grows, having community and connection to each other
Mm-hmm.
It's important because you will have those people saying, oh, I told 5 people and they said I was stupid. So having support becomes really, really important. Having regular commitment to your own personal tapping.
Mm-hmm.
One of the things that's so important is before you can ever work with somebody else, you need to do a lot of your own personal work to clear your own issues. So doing like Gary's personal peace procedure.
Mm-hmm.
So doing your own work, having partners that you can swap with,
mm-hmm.
creating community. You know, I've worked with, for example, Irene in Bulgaria. She's the head of the Bulgarian Association, and she developed another trainer out there, and she's done trainings in Bulgaria, and I've done some work with her. So you have, you have connection, you have online, you have swapping. You start to develop maybe a newsletter about different events that are happening. You bring in speakers and other people that people can start to learn from, just like you're doing online right now, right? Which is great.
And yes. And actually, I would add that Alina Frank will share with us about like sexual relationships soon in September.
Yeah.
That will be very interesting interview from Alina. Yeah. And actually, we would like to invite you, Craig, maybe make few master classes about this thing, like body and how it connected with emotional issues. Maybe we will do something online, so be subscribed down below on the Alex Guerra's website. Maybe, Craig, you have something that you want to say to us, to our Russian community, maybe something that you like, something growing inside from you to share.
Yeah. Well, you know what's fascinating for me is my grandparents and my lineage is all from Russia. And so it's wonderful to connect back to the Russian community and be giving this back. Yeah. Alina will tell you her story. She's from Cuba, and to be able to go back and give back to our, to our heritage and where we come from is really important. I also just want to say, that from everything that I understand, that people in Russia have had to deal with for so long, and there's a long history of pain and trauma, right? I mean, we all have that, but especially there, that there's to be able to deliver EFT and help support EFT to relieve the suffering, to relieve the trauma, is so important because, especially as we start to understand the epigenetics, that we tend to pass down the trauma of our ancestors to our next generation. Yeah. That means that even if the same thing didn't happen to them, they still carry the guilt and the pain of their grandparents and their parents, grandparents, great-grandparents, etc. So as we get EFT as a possibility for self-care, and doing their own work, and we can break that bondage and break the pain of that suffering, then our children can move forward without the shackles of that on them. And so my work, just doing my personal healing, will involve the thousands of people that go forward from my children to their children to their children. So the power of EFT is so large. And so I'm just honored that you've included us. I'm so thankful that the two of you found this to be able to pass it on to Russians around the country. The whole world needs this, and it's beautiful to be watching it grow as it does. And for you being leaders in your country to be able to bring this there, I'm so grateful.
Yeah. Thank you very much, Craig.
Yeah.